Today in Calgary, you are more likely to die of a drug overdose than you are to die in a traffic accident. We've got a very significant problem in our community. We're losing people every week, and we're losing them in every corner of the community, every background, every age, every gender, every income. And it's very clear that we in our community, really in any community, do not have a handle on what to do. We don't understand yet what a really effective community-wide addictions and mental health strategy is. And so it's really important that we think about harm reduction and safe consumption sites as one of 4 pillars in our strategy. We got to have harm reduction, certainly, because that's what keeps people alive. We got to have prevention to help people from even starting. We got to have enforcement to go after supply and to go after the dealers. And we have to have treatment at the moment people are ready for treatment. We don't have that in place yet. And so we have some problems. And it's very true that the supervised consumption site at the Sheldon Schumer has saved over 800 lives. It's prevented 800 overdoses. This is really important work. But it's important work that has to happen in the context of developing that broader community-based response. That's why earlier this year, I stood in front of council and asked for funding and approval of Canada's first community-wide mental health and addiction strategy to help us figure out what the medium and long-term solutions are here. At the same time, though, we have to make sure that the work we're doing to help people stay alive is also helping them get better. And we have to make sure that the work we're doing to help people stay alive is not doing so at the cost of the neighbors and of people who live in the neighborhood. From the moment that we stood in front of the cameras and announced the supervised consumption site at the Sheldon Schumer Centre, we have been monitoring the neighborhood to see what kind of social disorder has happened. And I got to tell you, it's been not consistent. Sometimes there's no impact at all, and in the last couple of months we've seen a real significant rise in social disorder, in crime, in issues in the immediate vicinity of the Sheldon Schumer. So the first thing we got to do is all hands on deck. City can't solve this alone, AHS can't solve it alone, Calgary Police can't solve it alone. We got to come together and make sure that we are working on all hands on deck on those social disorder issues. We got to make sure that things like open drug dealing, things like bad needle disposal, things like harassing and bothering others, and things like petty crime are dealt with using the tools we have. Because that's no good for anyone. And it's not good for the people who are forced into those actions, and it's certainly no good for the neighbors and for the businesses in the area. And so I'm very supportive of the kinds of things Councillor Woolley is talking about in terms of what do we do about that short-term plan. But I think what's critical is that plan, the immediate action we have to take to manage the social disorder in the neighborhood, cannot then sacrifice our need to work on that long-term strategy, our need to keep people alive and to help people get better.
What about the people that feel the city, this data suggests that the city should be moving a facility like this? We're closing it down altogether. What is your response to that?
Where are you going to put it? You know, the key is that you don't want to create East Hastings here. Nobody wants that. And so it's important that this kind of facility be located in an area where there are wraparound services available, that is easily accessible to people from across the community. You know, we knew full well that this was a residential neighborhood and did extensive consultations with the people in the communities who live in the neighborhood prior to start. And I got to say, the people of the Beltline, in particular the Beltline Neighborhoods Association, have been incredibly thoughtful about this. They've said, look, we understand there's a problem throughout the community that's affecting members of our community, it's affecting our neighbors and our families, and we appreciate the need to do something about that, and we will do that on behalf of the city. That's a great thing, but they don't then deserve to also have all the bad aspects of it. And we've got to take a little special care to make sure that those people can still live in a vibrant and great neighborhood.
These are issues that have been going on for a long, long time overall, this suite of issues, and this stymied a lot of attempts to try to resolve them. So in this specific context, you've got an acute problem here. What's a win actually look like?
There's 2 different kinds of wins here. The first is the big win, and the big win is to actually solve the problem. And I got to tell you, no city anywhere has solved this. That's why we're putting all this work together towards a systemic strategy. We're hoping that we'll be able to replicate the success many cities have had with homelessness, with a brand new model of how you deal with homeless people and how you help homeless people get out of their situation, which started about 15 years ago and has housed over 5,000 people here in Calgary. We're hoping we can replicate that in the big way in dealing with mental health and addiction, involving all those things. What that looks like, I don't know. What I know is we got the biggest brains in the city and some of the biggest brains around the world coming together to try and figure that out. In the immediate term, though, the answer is not close down the facility. The answer is not move it somewhere. The answer is manage the social disorder around the facility better and help to mitigate the impact on those businesses and on those individuals, and that's what we're going to do.
What do you see as the province's
Just
role?
to paraphrase, so I understand you. What you're saying is you basically want to see these indicator numbers that are causing the alarm show a bit of a trend in another direction. We need
Absolutely.
to get the rough edges off.
These indicator numbers, when you look citywide, some of them are going up anyway for various reasons. Some of them are staying level, some of them are staying flat. What really concerns me is the big difference on some of these measures between what's happening around the Schumer and what's happening in the rest of the downtown and what's happening in the rest of the city. And those lines got to come back together.
Is there a risk in overreacting to data like this?
Absolutely. And that's really what I'm suggesting here, is that it's important for us to understand that the real answer is that long-term strategy. And an overreaction to 2 or 3 months of data is not what you want to do. On the other hand, ignoring those 2 or 3 months of data and allowing those trends to go in the wrong direction is also a problem. The good news is we're good at measured responses. We know what to do, and I think that we will be able to do it.